So we talked last class a little bit about this philosophy that's going to drive the course forward, where we're not going to approach the course from a chronological perspective, but we're going to talk about theories. Eventually starting with the some of the more recent theoretical orientations, some of the more recent developments, and then moving kind of essentially backwards in time to the less frequently used theoretical orientations. That's not saying that less frequently used is not maybe the most appropriate term, as much as well, I don't know. Some of the theories are not used as routinely as some of the others. Some of them are not rooted in the same philosophical concepts as the others, and I think that'll become clear as we kind of go through the process. But I do want to talk a little bit about history and kind of how the theories have developed over time, because I think that that's a good orientation to. I think a snapshot of the chronology is important, and then we can kind of work backwards. It's kind of like, in my mind, we have to ground ourselves a little bit. So typically we would start with Freud. Freud's the father of psychiatry, the father of psychology. And so usually the first theorist that we talk about in the field. So Freud's theories, so it's important to remember that Freud was not a psychologist or a counselor or anything. Freud was a medical doctor. And so his perspective was kind of medical model, with the addition of some philosophical components to it. And so his theoretical orientation, psychoanalysis, technically, in order to practice psychoanalysis, you have to be a medical doctor. Like that's still a part of it. You have to be a psychiatrist to do psychoanalysis. We counselors would practice from a perspective called psychodynamic theory. It's the same thing. It's just you don't need the medical degree to call yourself a psychodynamic theorist. But really what Freud was doing there was Freud believed that everything that made up our mental health was somehow tied to our development, and that development was psychosexual in its nature. And you have to also keep in mind, I think, that Freud's client base was mostly wealthy, affluent, mostly women, actually, because as it was always explained to me, during Freud's era, the people who had time to do psychoanalysis, because psychoanalysis is very time consuming, were individuals who had enough money to pay him, but didn't have a whole lot of career going on. And so Freud's theory developed out of all of his time spent working with rich and affluent women of the time. So what happens with these theoretical orientations is, so that was Freud's theory, that was his belief, that drove how he worked with his client population. Freud did dream analysis and things of that sort too. He used himself as a model for many of his theories, and he was the only one really doing this at the time, so his students were then the sort of next step in the theoretical timeline. Next in line was Carl Jung. And so Jung looked at Freud's theories and said, no, I don't think this covers it all the way that I would imagine it does. I don't think everything is psychosexual in its nature. And so Jung took it to the next step. So Jungian psychology really looks at, Jungian theory really looks at childhood development heavily. There's this focus on the collective unconscious, this idea that so he did continue to talk about dream work and things like that. So, you see Freud's impact there. But Jung believed that we shared certain imagery, certain archetypes that were present throughout time, and that when we slept and we dreamed, we tapped into this imagery. And so a lot of what Jung talked about was this idea that these archetypes of meaning help to inform our decision making, help to teach us to lead a better life, help to kind of move us forward. And so Jungian dynamics are really focused, really rooted in some of these archetypal images. Move on to, and I'm going to try to do a quick snapshot. You move on to theorists like Alfred Adler, There were some more before, but Adler stands out because Adler's theoretical orientation was looked most like what we imagine counselors today to look like. This was not the professional as the expert and the client coming in to receive direction from the professional. Adler believed very much in a more collaborative approach. Still, though, very individually oriented. I think that's important to emphasize, is that Freud's work started with an individual focus on an individual client. And that continued until we hit the family therapy movement much later. So Adler was still focused on individuals, but did take a more holistic approach to the client. One of my favorite aspects of Adler is he talked a lot about defense mechanisms. And I really do think that a lot of what he had to share was really genius. But so you can see this evolution of Freud looking into our past, and that people didn't develop past the adolescent years, really. Once you hit adolescence for Freud, you had all of your development, and everything that happened in adulthood was a regressed connection back to the childhood and adolescent years. Jung focused on childhood a lot, and the imagery that comes up in childhood. Adler was one of the first people to look at, kind of, without coining it, a lifespan developmental approach, but still an individual lifespan developmental approach. As we move on, we see more of a focus in family theories. There was a shift to cognitive approaches. So instead of just looking kind of nebulously into the mind, there was this sort of theory of learning approach that started to dig itself out. There was also a behavioral movement. I think chronologically, the behavioral movement probably came first. Behavioral theory is... it's not one of my favorites. It's very effective, but it's not one of my favorites. So you had theorists like B.F. Skinner, John Watson, that were, working with clients to change behaviors. And so behavioral theory, and this is why CBT, cognitive behavioral therapy, really takes root and connects itself with insurance companies and things like that, and has become a really popular theoretical orientation. All of these theories result in changed behavior. And so as a result, you can operationalize that and test it. And so this is where we get this idea of evidence-based treatment. So these treatment approaches are evidence-based because you can see a result. So behavioral approaches, what B.F. Skinner was doing and so on and so forth, was rewarding or consequencing, basically, a client to change their behavior, and then we could say, yes, it changed, or no, it didn't, based on our approaches, and try something new. So the cognitive approaches and cognitive behavioral theory grow out of this because people realize that we are not just our behaviors, there's something that goes in before that. And so there's this idea that if we change our thoughts, that will change our behaviors. And much of what we do in counseling is working with thoughts. And so the cognitive approaches became very popular. We get into rational emotive behavioral theory when we add in an emotional aspect to it. So affect, behavior, and cognition, the ABCs of mental health treatment. Affect being emotion. Behavior isn't the be-all and end-all. We have thoughts that inform our behaviors. I'm getting ahead of myself, but I'll say one of the ways that you can test how this works is behavior is actually easy to change. If I, in a class, asked you all to put your hands up, most of you would. You'd choose one way or the other, but most of you would. And in that way, I would have changed behavior. I provided a suggestion. The power dynamic works in my favor as the professor. You're the students. I influenced you to change your behavior. So thought is difficult to change because people can think about things counter to what you're asking them to do. And in fact, if you ask them to do something, they may automatically think of the opposite. If I ask you to not think about something, for example, you'll probably think of that thing first. I had a professor who used to give an example of that by saying, don't think about a pink elephant dancing in the room. Of course, we all immediately thought of it. Now you can push it out of the way, so thought's a little bit easier to change. Emotion is difficult to change. It's very difficult to change the way a person feels about things. So we move into REBT, rational emotive behavioral therapy, we're at least starting to account for people's emotions. But think about how much time has passed from the point where Freud started. It took us this long and with this many theories to get to emotion and thought as part of the process for change. You talk about then humanistic approaches. So the idea that the counselor is not the expert, but the client is the expert. Carl Rogers is kind of credited with most of the work there. Person-centered approach. The existential theories come out of that movement. Eventually we see Gestalt as part of this too. Gestalt counseling is really interesting. It's really challenging for people, I think, but again, you're seeing this deeper look into not just behaviors, thoughts, and feelings, but now we're getting into meaning making. So it's not just enough to help a person to sort through their feelings, but we also have to kind of assess, what does that mean to a person? Do they have hope for change? Again, I hope you're seeing the evolution of the theoretical orientations. We had reality and choice theory come out of this, and all of these are kind of offshooting now. So whereas it was kind of a linear path and we had slight divergences after Adler, now we have, the behaviorist camp, which is still active today, the cognitive behavioral camp, which is very much thriving today. We have these more dynamic theoretical styles. We have the family theories. Some family theorists will only practice with families, and that is still going on today. And then we get into these further approaches. Solution-focused brief theory came out of the really where we were going with managed care and insurance companies, this idea that change should happen in the moment. Change should happen. Every session should involve change. Some of the solution-focused brief people said it's not enough that we do the work the way we do. Change should happen every session, or we shouldn't be paid for it, was basically what they said. Now, I don't necessarily buy that, but they really, really believe in this from a theoretical perspective, and it's a very effective approach because you're always making change with the client. What is it that the client is coming here for? It's not to, learn these deep-seated, internal dialogues from themselves like what we would have with Freud. Clients need to come in and make change. Our payers want us to, in order to compensate us, want to see results. Solution-focused brief approached it that way. Then you get into some of our more postmodern approaches like feminist theory, which is very popular, says that the political is personal and the personal is political, and you can't separate the two. So certain getting into really deeper meaning aspects of a person, that has to come into the room too, according to the feminist approach. Feminist approach doesn't just work with women. Feminist approach is applicable to all people from all cultures. But you see this historical growth process that I think is kind of important to touch upon before we get into the specific theories. This idea of, where we came from was informed by an influential white male figure, and the focus was very much on the individual person's perspective, nothing else, everything having happened early on in their life, nothing else informing the person's behaviors, thinking, feeling, etc. past that, to this very where we're heading now, to this very goals, results driven, focus on the client being the expert, focus on unmet needs, difficult meanings that people have attached to certain belief systems, values, all of that. So, I think that considering the history is important there, and I'm giving a very brief snapshot, but hopefully it's helpful in understanding how the theories have evolved over time. So, thanks, and I look forward to seeing you all.